Well, on the playground we heard, cross my heart and hope to die, stick a needle in my eye. But, on the other hand, cosmetic dermatologists say, when a wrinkle is the case, stick a needle in your face.
And I have one right here. We derms love we do. We inject very effective and expensive products into wrinkles. You may have heard of Botox. It temporarily stops the muscle from moving, particularly in the forehead and crow's feet. We also inject the filler, and this is a filler of hyaluronic acid. This also occurs naturally in your skin. Hyalurons hold 1,000 times its weight in water to volumize the face. The benefits are temporary and require repeat, slightly painful office visits and are not available to most people.
Oh, but we have news for our fellow dermatologists. There's a new kid in town. There is a way you could fill that wrinkle without a painful injection or an appointment.
What if, instead of injecting hyaluronic acid through a needle, the hyaluronic acid became the needle?
Ooh, and what if the needle shrunk into the shape of a tiny little cone, the size of a strand of your hair?
And what if those cones could melt into your most bothersome wrinkles overnight while you sleep, so you could wake up to younger looking skin?
Redefine acute care, skin care for expression lines.
Now you have the only advanced liquid cone technology in skincare to effectively smooth dynamic lines and wrinkles overnight, at home, quickly, easily, and painlessly.
Each acute care patch holds 125 liquid cones that melt into those lines you obsess over. You may see results even after the very first use and experience lasting results after just 1 month of treatment. And it's so simple, you can do it in your sleep.
These patches are designed to fit comfortably under the eye and around the lip. So whether in your 20s and just beginning to notice those lines, or you're in your 50s, and those lines have become already engraved, take acute care patches to bed with you and say, good night to the sticky wrinkle, and good morning to a younger reflection in your rear view mirror.
Think of it as bringing our office into your bedroom. And guess what? We're not going to even charge you for a house call.
That's right. I'll bring my needle. What makes acute care so powerful is the combination of highly effective ingredients and a completely unique delivery method.
Acute care delivers 2 very potent, hard-working ingredients that are abundant in young skin: peptides and hyaluronic acid. Pure and simple, 2 ingredients, nothing else.
Now, peptides are chains of amino acids that naturally occur in the skin, but they diminish over time with age. Our acute care replenishes oligopeptide 1. This is a highly complex peptide that allows the skin to hold onto the other hero ingredient, hyaluronic acid.
As Dr. Fields mentioned, hyaluronic acid is a naturally occurring, powerful humectant agent that holds 1,000-fold its weight in water. It's what fillers like Juvederm and Restylane are made of. And now, it's what the acute care cones are made of, to keep your skin looking juicy and plumped up.
Think of it this way. The peptide and hyaluronic acid work together a little like an inflatable baby pool. Here it comes. Oligopeptide 1 creates the framework to hold in the hydration that hyaluronic acid brings to the skin. Together, in the cone, these 2 ingredients fill the wrinkle.
Now, what really sets Acute Care apart is the patented liquid cone technology, and it's exclusive to us at Rodan and Field.
This unprecedented, completely unique delivery system comes from precision semiconductor manufacturing. Now, why would that matter?
Well, because your wrinkles need a perfect fit. By using a sterile, customized robotic platform, we create precision liquid microcones that are just the right shape and size to keep the hyaluronic acid and the peptide stable and potent.
Let's take a look and see how it works. Okay, here it comes. See how the patch lays onto the skin? The liquid cones of hyaluronic acid and peptide melt into the expression line, filling the wrinkle. Wait for it. There she goes. Let's move to what gets us really excited, the results.
Okay, after the very first application, Acute Care can provide visible results. Think of it as your pre-event quick fix. You know, kind of what you might want to think about using before standing on a stage with your face projected on a high-def screen in front of 8,000 people. So let's take a look at some of those results. Okay, here's the first one. I think it speaks for itself. You go to bed with crow's feet and you wake up with smooth skin. Now that's what I call a good night's sleep. Here's a guy who showed remarkable improvement overnight. And we know, you guys, you love your power tools. So for you men out there, Acute Care is a power tool for your face. Now, these are amazing results, okay, on the upper lip. From my medical practice, I can tell you, this can be one of the most challenging areas of the face to treat. You see those improvement in the vertical lines above her lip? And that was all done without a painful injection.
That's right, and importantly, this is interesting. With continued use, especially when used with the redefined regimen, Acute Care patches deliver lasting, sustained results. Let's see what can be achieved when used 3 times a week for 4 weeks. In this first slide, you see that the eye is tighter. That lower fat pad is brought in, and there's smoothing all around the eye. In the next slide, you see the same. This is a very important area, very stubborn area to treat in our medical practice. In the next slide, does anybody out there sleep on their face, or is it just me? All right, that's called sleep crush, and those lines get engraved into your skin just like a wrinkle. And with Acute Care patches, you can see the skin is smoother, and you don't have to worry about that big issue. We love this. It's amazing.
Wow, it sure is. So next we wanted to learn how long the benefits of Acute Care would last once the patches were stopped. So in an independent clinical study, we had subjects use the redefined regimen along with a 4-week course of Acute Care. Now after the 4th week, we had them stop the Acute Care patches but continue using the redefined regimen. And as you can see on this graph, at week 4, they had a significant improvement in the appearance of their crow's feet.
What's especially impressive is that the benefits from using Acute Care for only 4 weeks persisted for another 8 weeks.
Wow.
So you see her at baseline before they start. Beautiful at 4 weeks, sustained benefit at 8, all the way into 12. She still is smoother than when she started. It's amazing. So at this point, after 12 weeks, we'd recommend another whole session of Acute Care patches.
Okay, the message is simple. Whether you're in your 20s and you want to prevent those lines of expression from sticking, or you're in your 30s, 40s, and beyond, and you would like to do some correction, Acute Care sticks so your wrinkles won't.
Fill a wrinkle while you sleep. No needle required.